depression and anxiety are addictions. Someone may say, this man is out of his mind. How can depression and anxiety be addictions? An addiction is an addiction, depression is depression, and anxiety is anxiety. There are tons of books written about each of them. There are numerous theories about their causes and different modalities of treating the disorders. Yes, indeed, there are many theories, but I believe all of them are but intellectual guesses. We may never know where the problem comes from. It may be something that happened to you in your childhood, and you may quickly identify it. You don't need years of therapy for it. But it may be connected with your ancestors, your genetic memory, or something happened to you in your previous incarnations. The reality is the pain of the now and how you deal with it. And that's where I believe that an addictive aspect comes in. Once you know what the problem is, once you know that you cannot add more to resolving this problem, it's time to let go. But most people find it difficult to do it. It's as if they are addicted to the same thoughts. Most of these thoughts are non-productive. How long does it take to figure out what to do about the situation? And yet a person usually goes back to the same repetitive thoughts, feeling remorse, guilt, regret, if it's depression, or having doom and gloom images of the future, if it's connected with anxiety, creating the worst possible outcomes. These castles, horrific images, castles of horror in which they then choose to live. And they know it's not good for them. And yet, just like an addict, they're compelled to go back to the image, back to the thought, and cannot stop. So, my attitude toward it is acknowledge what it is, just like an alcoholic or a drug addict acknowledges there is a problem. And then slowly begin to work on bringing yourself over and over to a present moment. Acknowledging that an addictive impulse comes in and saying, I choose not to go there. It's over, it's the past. But it's not easy for many people to do it. That's why I believe it's very important to practice your will. It's a whole different subject, and we'll have a different talk on the subject. But for now, just experiment. See those negative thoughts, whether it's about the future or the past, whether it's anxiety or depression. See them as addictions. Acknowledge the addictive impulse and choose to bring yourself back to the present moment. And of course the thought will come again and you go, oops, this is now. You can say, oops, here goes Peter, or here goes Natalie, making up a story, which means talking about the future. Here goes David, going to the graveyard. What graveyard? To the past. Just like something that happened in the past, you may have lost somebody, and it's okay to go to the cemetery once in a while. It's okay to feel the grief, but you cannot live at that cemetery. The same thing with something that did not work out in the past. Something that you have to let go of. You acknowledge that it's the past and keep it in the past. Always bring yourself to the now.